In this video, I'm gonna teach you guys about a really cool procedure that Josh Hart underwent to treat his patellar tendinopathy, and we're even gonna go and take a look at what these actual structures look like under ultrasound. Josh Hart was dealing with knee pain throughout the season and was ultimately diagnosed with patellar tendinopathy, or jumper's knee. After unsuccessful initial treatment, he underwent an ultrasound debridement procedure on his patellar tendon, and he's now expected to be out for around 12 weeks as he heals from this procedure. In this video, we're gonna go over some very basic ideas behind patellar tendinopathy, and then we'll talk in detail about this specific, really advanced procedure that Hart had done to ultimately try to treat this condition. As always, hit that subscribe button if you guys like this and want to see more of these videos in the future, and let's get started. So the patellar tendon, of course, is the tendon that connects the kneecap to the tibia and is that terminal portion of the quadriceps muscles that extend the leg. I'll do a more complete video later on talking about patellar tendinopathy, but it's essentially this chronic degeneration and breakdown of the patellar tendon that causes pain and impaired function. Now, key thing here, it's not patellar tendinitis. Tendinitis implies that there's inflammation, and this was initially how it was described, but then we did more research and found that when you actually look at these diseased tendons under a microscope, there's really not any inflammatory cells present. So the correct word is more of a patellar tendinopathy, implying a general breakdown or disease process in the tendon. Over time, you get these microtraumatic kind of tears in the collagen fibers of the tendon that cause it to break down, become frayed, and then accumulate damaged tissue. Along with that, you get increased pain, and the tendon doesn't work as it's supposed to, and so you can have impaired biomechanics and function. The initial treatment, of course, for this patellar tendinopathy is conservative, rest, and physical therapy. With therapy, you're trying to more properly load those collagen fibers in the tendon to stimulate that repair and regeneration of proper tissue. But if those conservative measures don't work, then they can actually do surgery to help try to treat this problem. Surgeons will go in and actually try to debride or clean out the damaged portions of that tendon. Whenever they go in there and cut around, that also stimulates this acute kind of healing inflammatory process that helps to lay down the normal improved collagen fibers to restore tendon function and improve pain. But that kind of stinks, right? To have your knee cut open and have this big surgery. And so doctors tried to develop a new procedure, and this is where this specific ultrasound one comes into play. A lot of you know ultrasound because of when someone's pregnant, they go and they have an ultrasound of their baby. But we're learning more and more uses for it because it's a really great imaging modality and can be used to help do some different treatments as well. The basic physics behind how an ultrasound works is it emits sound waves that reflect off of the tissues and then bounce back up to a crystal that's inside the probe. That crystal vibrates a certain way based on the sound coming back and then generates an electrical signal that gets interpreted as those black and white images you see on the screen. Now, switching here to an actual ultrasound image, this is my patellar tendon and knee. This is a location of where you can see the ultrasound probe. And then on the screen, you can see what these different structures look like. So we can look at it kind of cutting across in short axis, as we say, or we can look at it kind of lengthwise, and it has different appearances based on that orientation. But this is what a healthy, normal patellar tendon looks like under ultrasound, and this is what those doctors are seeing when they do this procedure. So what are the details of this type of procedure that Hart had done? Basically, what you're trying to do is accomplish the same goal as the open surgery, but in a much less invasive way under ultrasound guidance. You're still trying to go in and break up or debride that bad damaged tissue in the tendon and get it out of there and then stimulate that healing process. There's this awesome tool that some really smart people developed where it's basically a glorified needle, and you put the needle into the tendon and it emits this ultrasonic kind of sound waves that help to break up that diseased, damaged tissue inside the tendon. At the same time as it's emitting these sound waves, it's irrigating that area and then has some suction to try to suction out that damaged tissue from the needle. So you put the needle into the disease process in the tendon, you vibrate it with a bunch of sound waves to break up the damaged part, and then you irrigate and suck all that damaged part out. Even just the simple idea of going in with the needle and poking that tendon stimulates this healing response that brings in all those cells that are necessary to lay down the proper collagen and tissue for that tendon to heal and recover. But this is a really neat thing. It's much less invasive to the athlete or the patient having it done, and it's not this big open surgery like you would have to do otherwise. The reason why it's such a long healing process after just having a needle put in is you really are poking little holes in that tendon. A lot of people, when they've had this procedure done, actually have a lot of really immediate pain relief because you've broken up and removed that pain-causing tissue. One of the reasons patients are told to take it easy and rest for a while is because without that pain, it's tempting to go out and want to jump and run and play. And so you have to really rest and allow that tendon to heal before subjecting it back to more load. You then go through a physical therapy program like you would with any other injury and gradually progress back to your athletic ability. But this is just one of the areas where ultrasound technology is really exploding, and we're gonna see more and more of these types of procedures in the future where things that athletes previously had to go and have a big open surgery for can now be done with just ultrasound guidance. It's one of the big skills we learn in my specialty with physical medicine and rehabilitation, and is a really awesome tool for our patients going forward. So that's it for the video, guys. I hope it was educational and you learned something about ultrasound and about this technique that we can use to break up that tissue and try to treat patellar tendinopathy. As always, leave any questions or comments below, ideas for future videos or anything else. And until next time, thanks for watching, and we'll see you later. Bye.